with the new information that has been coming out about children being active spreaders, even if they're asymptomatic, and that asymptomatic people actually can spread as much as symptomatic people. Um, we're kind of back where we were in the beginning, where we don't know who's spreading the virus. You can't assume because someone's not sniffling, coughing, or anything else that that person is not capable of spreading or does not have the virus. So all these things are of concern to us. They remain to be issues of concern. So we feel pretty strongly that we have to continue our policies to keep people safe, and that means wear the mask, um, keep the physical distancing, and follow all the other safety precautions of washing your hands. And I think some people have read the stories about masks and whether the spread of the virus in the air is actually longer than 6 feet. Um, that's an important study. You know, people are looking at it, looking at supporting data and what else is out there. But frankly, from my perspective, people should just accept wearing a mask inside and outside, period. Um, that is the safest thing to do. There's a study out. You can go on the web. You'll see which masks actually are more effective. All masks are not the same. I think gaiters were at the bottom of effective things, and the hospital masks were toward the top of effective things. So you got to be sure you have the right mask on. But I think it's important, and I think we will eventually get to a stricter view of how we have to treat um, how you have to treat wearing of masks. But I do think more serious use of masks is important. I just remind people last week we updated our phase 2. We allowed some businesses to reopen, and at the same time we put a stricter stop on restaurant activity. We didn't close restaurants at 10 o'clock, but we said that they have to stop serving alcohol at 10 o'clock. It's because it's just hard to have inspectors out there at night when they're out there, basically all day long doing inspections for us in the county. And we know that in late at night, the later it gets and the more the evening turns to drinking rather than eating, the more the social distancing and other requirements that we have tend to fall by the wayside. We will continue to evaluate this and see if there are other ways of guaranteeing that restaurants remain safe for the entire time period they're open. We've had a number of suggestions, and we're going to continue to evaluate that. We know that contact tracing continues to show that people congregating in establishments late in the evening have a greater risk of physical contact and less ability to socially distance. We know that a quarter of those interviewed by contact tracers now show that indoor and outdoor dining as significant sources of transmission. And this gets back, we don't want to have to close these things down, which means we need people to adhere to the strictest possible guidelines so we can keep them open. It was, something we were really happy we can move in that direction, but to be able to stay in that direction, we have to make sure these do not become major sources of infection in the community. For comparison, Baltimore City doesn't allow indoor dining at all now. They went back and shut down indoor dining. And Anne Arundel County doesn't allow alcohol to be served after 10 p.m. We are reviewing guidelines for soccer and swimming. Um, we get a lot of comments on this. I will say, particularly on the soccer thing, and when this issue got raised, I did some quick Googling last week, and in my Google feed on soccer high risk or not high risk, on the very same day, I think it was July 24th in Virginia, they elevated from medium to high risk, and in Massachusetts, they lowered it from a high risk to a medium risk. I say that because there is no absolute science and no absolute certainty on what risk it is, but for sure it's not a low risk. But we're continuing to look at the information we get, and we've been open to revising our guidelines in the past. We'll continue to do so. And finally, I want to say that we are getting ready to launch the rental assistance program, eviction prevention program. It's focused on folks who have not been able to pay the rent because of loss of income and who are going to be hardest hit. I want to thank the governor for extending the moratorium on evictions. I have reason to believe that until there's a solution, which has eluded us so far, he is likely to continue that because none of us want to face the prospect of tens of thousands of people in the county and around the state losing their homes over income they didn't have because everything was closed because of the coronavirus. And frankly, I feel the same way about commercial property. A lot of people with that income are going to have a hard time paying their bills. And whether you're a commercial tenant or a residential tenant, there ought to be forbearance for that. And we need to figure out at a national level a solution to this problem rather than just delaying it until the day the evictions now become legal. And then the people who weren't able to pay rent before will not be in any better position to pay back rent when we decide it's okay to collect rents again. I want to thank the council for quickly approving our proposal to put $20 million into this fund. And we're continuing to ask the state to continue to increase their support. And I think I'll stop there.
Dr. Gales.
Good afternoon, everyone, and happy Thursday, since we're back on Thursday as opposed to our standing date on Wednesdays. I just wanted to add a couple comments from what the county executive mentioned and then leave the floor open for questions. I did want to just clarify one thing. I think Baltimore has now reopened to indoor capacity at 25%, but to the county executive's point, they did go back when they saw an uptick in cases a few weeks ago where they did close indoor dining completely, and just recently made that updated change. The county executive mentioned that our numbers have bounced back and forth a little bit, both on a local level as well as a state level. And we continue to monitor not only the daily case count, we monitor the test positivity, but we also look at a host of other types of metrics, including all those on our dashboard that look at the percentage of folks in the hospital and what types of care they're receiving. But we've also noticed as the cases have bounced up and down a little bit in the last month, we've also started to see more significant trends and changes as it relates to age distribution. And one thing of note, particularly given the attention related to activities associated with kids, including schools and sports and other types of things, we've noticed an increase in the percentage of cases in the 0 to 19-year-old age group. Historically, throughout the pandemic thus far, that age group made up a smaller percentage of cases in comparison to others. I think cumulatively, that the age group was making up somewhere between 8 and 9%. Over the last month, both here in Montgomery County as well as looking at the state level, the percentage of new cases in 0 to 19-year-olds has increased to 17 to 18%. So basically, it's almost doubled in the last month. And that's concerning because we're seeing more cases pop up in kids. And we know that can be secondary to more kids being tested, particularly given the different mechanisms to test asymptomatic individuals. But it's also concerning, as the county executive mentioned, is not only are more people getting tested, which is great, we want to test as many people as we can, we also are picking up more cases, and that's problematic. So again, we will continue to look at the whole constellation of all of these different variables and metrics to help guide our decisions in terms of how we move forward, whether we're talking about schools, activities, restaurants, personal services, etc. Now, one other thing I wanted to highlight for folks at home is one of the things that has popped up from contact tracing is that we are seeing a higher percentage of cases tied to family gatherings. Now, we recognize that in the space with COVID fatigue, however you want to define it, and it's summertime too, people are getting together more frequently and they're interacting more frequently. The concern we have is that when we get into family gatherings, particularly where we're bringing in family who don't share households with us, is that there may be this dropping of the guard a little bit. And there may be less adherence to those physical distancing maneuvers and measures and less adhering to wearing face coverings. And we want to emphasize to folks at home is that, yes, it's okay to have have gatherings. It's okay to get together, but in that setting, you still got to adhere to those public health guidelines, even if it's around your family members. So we implore you that if you are having family gatherings, continue to respect the size of those gatherings and continue to make sure that you're adhering to those same principles that we've asked you to do if you're in a room full of strangers or around people outside of your house. Even, continue to do those things when you're in the setting of family members. So just want to emphasize that to folks, as we have seen that as an indicator in our contact tracing data from the state. And as the county executive also mentioned, there are a number of recent studies that have come out on a host of topics, including everything from studies suggesting that the virus can spread further than 6 feet, as well as a recent study by Duke. And I say Duke, everyone knows this is my alma mater, so got to give a plug. But in terms of the types of masks that are considered to be safe. And so I say all of that to say that we continue to monitor those studies, and we will continue to adjust our guidelines that we put out to the public accordingly to that data as it comes in. So thank you for continuing to be patient with us. Thank you for continuing to adhere to the guidelines that have been put out. And I will turn the floor over to Dr. Stoddard or open it up for questions. Thank you.
Okay. Yeah, I think we're going to go straight to questions as long as Dr. Stoddard doesn't have anything. And Chris Gordon with Channel 4 is our first question, and he's got one for both the county executive and Dr. Walls.
I believe I'm unmuted. Thank you very much. This morning, Dr. Jack Smith was part of a panel with the Maryland Senate President and Senator Pinsky talking about what's needed down the line to feel comfortable reopening public schools. And he talked about something, and I think the county executive just touched upon. He said, our county health officer has given us metrics and is doing a great job, but we need statewide metrics. He basically, Dr. Jack Smith said, it's critical that Maryland State Department of Education and the Health Department establish metrics so the school system can gauge what happens next based on those metrics. Do you agree with that? What would that mean to Montgomery County, considering the day when in-person learning might be allowed?
Who wants to go?
I'll defer to you, Mark, and then I'll follow up with him.
So I think it's important that the state provide metrics and guidance. It is stunning that this is an area they've chosen to be quiet about. I looked at the reopening guidelines, and there is information in reopening guidelines related to schools, but apparently it only applies to public schools. And it's not specific enough to really draw up a plan, though it provides guidance in the direction a plan might go. If they're okay with guidance for which direction it might go, they need to let us know that and let us make sure we fill in the details. But we need to know that's what we can do. Obviously, we're feeling rather constrained about what we can do on the school front as a result of the governor's decision. But the thing I would raise, and I'd invite reporters to look at the reopening, if those are what you expect public schools to do, you would think that's the minimum standard that you would be setting for private schools. It makes no sense to have one standard for public schools and say, this is what you have to do to make sure that children, teachers, and staff are safe, and then not set a standard for everybody else that's the same. There's no logic to treating one student or one parent or one family or one teacher or one cafeteria worker different than anybody else. So I look forward to the state giving us some really clear guidance that people can look at and evaluate, and people can make plans around.
Dr. Gales, you good?
I'm good.
Okay. Suzanne with Montgomery County Media has a question for, not clear on who that's for, just regarding Advigenics. Suzanne, go ahead.
Thanks. I just basically want to find out what the problem was with Advigenics and are they only used at the two particular sites in White Oak and Silver Spring? And does that mean some of the results that had done previously are in question now?
As the county executive mentioned in his opening statement, we were notified yesterday that there were some concerns with Avigenics Lab. We don't have the specific data right now. And so when we found that out, in an abundance of caution, and until we get more specific data, we made the decision to temporarily halt our test sites that had used the Avigenics test kits predominantly. Now we are working behind the scenes to repurpose those sites and also looking at other alternatives to be able to stand up and continue to offer testing in that setting until we get more specific results to be able to answer the questions that you have in terms of what that means from a larger perspective.
Caitlynn Peetz with Bethesda Beat has a question for Dr. Gales.
Hi, good afternoon. I've been getting a lot of questions in the last week or so about why childcare providers like Barty and Kids After Hours were recently approved to provide services in school buildings when schools have been advised to not reopen. Can you just explain why it's okay or safe for those providers to operate and for schools to not reopen, and what guidance you'd give to families considering whether to utilize those services?
Well, the first component of your question is, unfortunately, as was mentioned, there is an ongoing litigation regarding some of these issues that I'm not able to comment specifically to the first part of your question, unfortunately. Now, as it relates to specific, partnerships with schools and so forth, we're continuing to look and find out information to understand what those programs offer and what they provide. I think this introduces an interesting question that, we do have more data points, for example, when we look at childcare, because childcare has continued throughout the pandemic in some capacity. Whereas schools have not been open. And so we don't have data points to guide to show what are best practices for specific guidelines that are being talked about being put into place. And so there are some differences and it's not an apples to apples comparison when you're looking at childcare versus school settings. So as we continue to find out more information about specific programs, and then also, again, recognizing some of the limitations I personally have in answering that question, we will provide more information to you all and to the general public to be able to guide those conversations and discussions.
The only part I would add to that is that the Maryland State Department of Education did release child care guidance pretty early on and has most recently updated that on August 5th. No such guidance has existed to date or is currently available for schools. So, it's hard to ensure safety when there is no guidance that has been provided to ensure it with.
I'll just add that the county did not close the public schools. Just to be clear about this, this was not a county decision. This is a decision made by the school system, upon review of the circumstances. And that was their decision, much as it was in the other counties around the state and the region that have done the same thing. I saw a story about Barty. I don't know how many or how much they're going to do in a school, but if you're talking about occupying a few rooms in a large building, that is very different than occupying all the rooms in a large building, which means all the bathrooms, all the hallways, all the food provision, all those things become greater risk points than if you have a limited number of students in a facility. And as Dr. Stoddard said, and the state actually offered guidance on how to offer childcare, so they have to meet certain criteria in order to be able to do that. We still wait for that for the school system.
Okay. Chanel with WDVM has a question for Dr. Gales.
All right, hi everyone. My question is about Advigenics again. I wanted to know exactly how many people, if you know, were tested, and what happens with these if you don't have the data and how it's being worked. What happens there, and do you have a timeline on when you will open these testing sites back up?
Well, again, I'll repeat what I stated in the previous question is that we don't have the specific data yet. We were just given a heads up that there have been concerns, and the state who has authority, and the state and federal level who have authority in terms of making determinations in terms of how they practice. Are compiling that information and will release whatever determination that they have. Once we have more specific data to guide that conversation, we will put that out and make the necessary changes and adjustments to our platform, as well as whatever other relevant notifications that have to happen. To be perfectly candid, when we look at our program, when we received a notice that there were concerns, we just said, okay, and until we get more information, until we can definitively answer those questions, we're going to halt utilizing that platform for our tests today and in the short-term future. Now, recognizing that testing still is incredibly important, regardless of who is providing the source of the test, we are working again behind the scenes to be able to stand up those sites that we've had to temporarily postpone to be able to continue to provide that resource to our community. And we had already been in the works again of, we constantly are looking at ways to improve our platform, whether that's through looking at new technologies, new collection mechanisms, those kinds of things, as we get more options that become available. And so we're continuing to explore those. And as you all know from this 5 to 6 month process now, we have worked with a number of other labs as well to provide support for our testing platforms, and we will continue to leverage those partnerships as well. In the meantime, until we find out, as the county executive mentioned, we find out more specific data as to exactly what has happened and how we need to move forward.
Kevin Lewis with ABC7 News has a question for County Executive Elrich.
Hi there, County Executive.
Kevin.
In the past week, I've reported on inmates that have been released following emergency motions hearings. In one case, an inmate went on to commit a murder, allegedly, in Germantown. I reached out to Councilmember Craig Rice, since that fell in his district, and he said, and I'll quote part of it, while we have a responsibility to ensure the health of inmates incarcerated in our jail, that does not nor should not supersede the concern of risk that released inmates may pose to our community. These cases are continuing to hit the district and circuit courthouse. What, as county executive, would be your message to judges that are taking a look at these cases, and also the state's attorney's office, who's apparently being inundated and has been inundated with these emergency motions for release?
So the first thing I'll say, we did not blanketly empty our jails. We did not look at this and say, well, everybody gets, this is a get out of jail situation and everybody leaves. I would assume and would hope that when you're deciding who gets out of a jail, that you're looking at the risk that that person causes to the community. What's their history? What's their record? What's the accused crime? What kind of information do you have about the crime that should raise your levels of concern about, a person's, likely future behavior? It's not as simple as just somebody going in and saying, I want my person out of the jail because the jail is a dangerous place to be. Actually, our jail is probably a pretty safe place to be. The number of COVID cases in the jail seems to be well under control. But I would expect people to do due diligence on the people they're letting out and make decisions about what's the right thing for the community in that case. But as I think I don't have anything to do with this. I don't make decisions about who stays in or who stays out. Those are all made by judges.
Do you and totally understand the point you're making, that this isn't your call here? In looking at these two cases, particularly the homicide case, do you feel that the judge should have looked more closely at this, or do you feel he made the right decision and this is just an unintended consequence? So
I don't know what the judge looked at. I mean, I wasn't there for the hearing. I haven't, heard what was done in the hearing, what the judge got to look at in terms of paper and history. So I can't comment. I mean, obviously this was the wrong person to let out. What the judge knew and how it was presented, I don't know, honestly.
Okay, Jack Moore with WTOP says he's having some sort of audio issues. Not clear, Jack, if your questions have been answered already or if you have your audio back. Let's give it a quick try. Okay, we will check back in with Jack in a little bit. In the meantime, Briana with Bethesda Beat has a question for Dr. Stoddard.
Yeah, thanks. So Dr. Stoddard, I know you mentioned that your office is working with the local Board of Elections on the upcoming November election. What is the plan for keeping voting safe during the election? Do you know how much of a shortage of election judges there will be? And for the recently approved state's plan for voting centers, do you know how many polling places and high schools will be used in the county as voting centers?
Sure. So we have a more formal update coming from Board of Elections tomorrow, but to give an update, it's not just my office that will be supporting Board of Elections. It's going to be a holistic county effort across the board. We've already had connections with our Department of General Services, for example, around installation of plexiglass and other precautions, getting, measuring sizing out and things like that. So as I understand it, we have 11 early voting sites, and then we have 25 high schools. So we'll have in the area of 36 voting locations that will be available per the plan that was approved by the state board. The local board meets, I believe, on Monday to approve said plan for the local level, and I do expect that they will do that. We are already talking to our Board of Elections about getting, things like testing for election board members, our election judges, personal protective equipment, installation of plexiglass. Obviously, this will be I'll call it a full court press from across county government to ensure that we can offer a safe elective option. Obviously, that includes things like installation of drop boxes as well to allow for, direct delivery of ballots as opposed to having to rely on the U.S. Postal Service, which we're well aware of the national news associated with the U.S. Postal Service right now. And so we want to have options available to people where they can drop ballots off, they can do in-person voting in a safe fashion, and if they vote early enough, obviously via the mail. And so we're trying to give as much flexibility and while considering safety. We expect that we can do that. As far as the election judge question, I'll need to get an update. I know that we had roughly we had about 1,300 election judges lined up. If we had done a normal election, we needed something like 4,000, but I haven't heard the revised plan exactly what the new strategy will mean in terms of those numbers. We have already had conversations even within within the county government about how we will substitute in additional support for those sites. We will have staffing for our election sites, and we will work that out with our Board of Elections to make sure that that happens. I can give more robust updates. Obviously, this is something that sort of just moved quickly this week, and so I'm sure in future weeks we'll have a much more robust sense of all the things that we're going to be doing, given that this was just approved this week.
Looks like our last question will be from Jack Moore. I don't think his audio is working, so I will pass along the question. Regarding testing, still seeking clarity on why only Silver Spring and White Oak testing is closed. Where else can people get tested in the county?
So the reason why those were closed were because they were county sites that utilized the lab in question. And so all the other testing modalities and mechanisms are in place, and we have a pretty comprehensive set of where those spaces are attached to our county coronavirus website. That's updated on a regular basis to provide a litany of places, including county sites, as well as the other sites that are through the healthcare arena and facilities. And so again, as we are working furiously behind the scenes to try to leverage the other resources we have to hopefully be able to continue the sites that are scheduled, we will work very quickly. If we need to make any adjustments to that schedule, we will work very quickly to notify the public and let those folks know who are scheduled, and also work quickly to let them know of alternative sites once we have those stood up.
Okay, and looks like our last question of the day is from Briana with a question for Dr. Gales.
Yeah, I just had a quick follow-up question to that. How does closing the two sites affect your testing capacity? How many tests roughly did those two sites were they conducting?
So they're actually too large. You know, our Silver Spring site that was closed today has been testing in the days that we've had it open between 700 and 800 folks. And the White Oak station usually tests somewhere on average between 400 and 450 folks. So that, you know, that volume is significant, which is, again, is why we're working to stand up other alternatives. Again, recognizing we are waiting for specific data to be able to guide that conversation and discussion. But, you know, we also are looking to be able to leverage the other resources we have to be able to get those folks who were scheduled in as quickly as possible to test, as well as making sure that we have continuity and sustainability of the testing efforts that we already have in place.
And for anyone who needs testing information, the website to go to is mococovidtesting.org. And we promote heavily testing availability via our Twitter account, which is at Montgomery COMD. And Rebecca Tian is asking, is that 700 daily? I think she's referring to.
That's 700 for that specific site, which is only on Thursdays.
Just for context, I think Dr. Gale said last night that Advogenics has done roughly 7% of the total tests across the whole county. So that's inclusive of the healthcare system. So just to give you some context for what Advogenics represents as a total of the whole testing conglomerate in Montgomery County, including our private healthcare providers and everything else.
Okay, Jack Moore apparently has his audio back. He's with TOP and one final question for the county exec.
Yes, can you hear me?
Yes.
Yep.
Oh, perfect. Okay. County Executive, I know you said that you're still waiting on any kind of guidance from the State Health Department on reopening private schools or schools in general, but can you tell me, have any private schools in the county come to you with plans in your, one final thing, you mentioned that some had already said, some of the big ones had said that they're planning on not returning. Can you just give me those names? I hadn't seen that.
I'll let Dr. Gales, because they don't come to me with plans. They come to either Earl or Dr. Gales with plans. So what they've seen or what's been submitted, they can tell you.
We've probably seen, yes, we've had several plans submitted, maybe as many as a dozen through various mechanisms, through various avenues. We've basically been telling people who submit plans, number one, there are 140 schools for us to review, so please bear with us. Number two, and more importantly, we are waiting on state guidance upon which to even base our review of your plan. So we're willing to review plans, but we need, if we're comparing your plan to something, we need this something to compare it to, and that's what we've been waiting on.
And who's announced they're closed?
We had a list, I think, that Dr. Gales had put together.
Yeah, there were a number of schools that we received feedback from who, based upon the initial order that was put into place, and actually based upon the way it was communicated, based upon the initial meeting that we had with the non-public schools on that Wednesday where Dr. Stoddard and I participated and answered questions. And so I think, you know, there were forwarded to us a number of letters that principals and headmasters had sent to their families of their schools. We can get a list of those. I don't have them right off the top of my head, but there were a number of schools who had made the decision to postpone in-person schooling, secondary to the town hall meeting, and then secondary to the order. Now, since then, I don't believe any of them have retracted or rescinded their directives. And you know, it's still unclear whether there will be schools who continue to choose to do so, even in the setting that require the rescinding of the order that we have put into place.
But I also want to be clear, the schools do not come to us generally to tell us that they're going to be open or tell us that they're not going to be open. We're drawing this from you know, reports that come in from various sources, and so there's not an official process. So we don't know how many schools. We don't know if there are schools operating today in Montgomery County or not. We don't know.
And on that note, we will end it there. As always, all of our media briefings that we do here each week are posted to our Facebook page as well as Twitter. So thank you for joining us this afternoon. Stay healthy and stay safe.